My name is Jennifer White, and I am a licensed practical nurse in the baccalaureate program at Indiana State University. This is my fourth health education project in the spring of 2021 for Community Health Nursing Class 444. I will be discussing autism in children. By the end of this presentation, the participant will be able to 1. Broadly define autism, 2. Identify the diagnosis criteria, 3. Recognize medical conditions that may exist with autism, and finally, summarize measures that can be taken to ensure a good quality of life for children diagnosed with autism. Please pause the video here and take the pretest listed in the comments below. Autism is a developmental disability that is very difficult to diagnose and may go undiagnosed for years. According to Celia et al., 2016, the CDC states that 1 in 68 children are diagnosed with ASD, or autism spectrum disorder, and it is more prevalent in boys than in girls and can occur in all racial and socioeconomic groups. There are no outward signs that a patient is suffering from autism, and the symptoms may be attributed to other conditions. At this time, researchers are unable to define why a child has autism, but there have been links made to mothers who had infections and fevers during pregnancy and early exposure to air pollution. Children may interact with others differently, not share the same interest in playing as other children do, and they may perform tasks repetitively and are thrown easily by a change in their routine. Children with autism can range from being extremely gifted in intelligence to severely challenged in intelligence. The patient's pediatrician should perform routine developmental evaluations of the patient to confirm where they are related to other children their age. According to the DSM-5, there are 2 areas that the patient must be deficient in persistently to meet the criteria for a diagnosis of autism or ASD. The first is interaction and communication with others. Many children with autism have some form of communication difficulties that range from not communicating at all to limited eye contact, unable to maintain or initiate a conversation. They may not share with others and may have a flat affect or show little interest in things around them. The second criteria is repetitive or restrictive behaviors. These can include repeating words or phrases over and over, or flipping toys or objects continually. Children with ASD are easily upset when their routines are changed in any way. They may become fixated on an object or an idea to the exclusion of everything else. These children are very sensitive to noise or other stimuli and can be overwhelmed easily. Autism is very difficult to diagnose because of the developmental delays. The patient is not able to verbalize if something is wrong, and there are no medical tests to date that can be administered to help with the diagnosis. Although a new study has been launched in Hong Kong, this study will be used to substantiate studies already in place that indicate associations between retinal nerve fiber layer thinning and significantly larger optic discs in children with autism. Eye exams may aid in the diagnosis of autism in the future. Pediatricians must be aware of these children's baseline findings and then be able to identify anything outside of the norm. While the diagnosis of autism itself is difficult, these patients also come with a host of medical conditions that can be developed in concordance or secondary to the autism. Since autistic children are not able to communicate well, many medical conditions may be misdiagnosed or not identified right away. One comorbid condition that is easy to miss in children with autism, according to Celia et al. 2016, is sleep disorders. These can be caused by many things, including decreased melatonin production, GERD, or disruption of the circadian rhythms. Sleep disorders can be treated with a melatonin supplement. The lack of restful sleep in the autistic child can influence their attention span, their training, and their behaviors. There also may be immunologic issues with autistic children. They often suffer from multiple allergies, including food and environmental allergies. Physicians should monitor these children for signs of allergies, to include rashes or sinus issues. The best treatment for allergies is to avoid the allergen whenever possible. Gastrointestinal issues are also very common in autistic children. They can include reflux, inflammatory diseases, food intolerance, and irritable bowel syndrome. Gluten-free diets are gaining popularity within the autistic community because this diet helps to alleviate many of these symptoms. Celia et al. 2016. Autistic children may also suffer from seizures, which are made more difficult to diagnose because these children often have periods of blankly staring off into space or performing repetitive motions. Early intervention is the key with autistic children. The sooner the condition is recognized, the sooner the patient can begin receiving therapy to help them to learn to walk, talk, and interact with others. Speech and behavior therapy can begin early in the child's life, even before they begin school. Once they've been diagnosed, autistic children can obtain special education to assist them with learning, behavioral issues, and interacting with others. Great strides are being made to assist teenagers and young adults with autism to transition into the workforce and to have long, successful, and fulfilling lives.